Jeremy Hunt today on the BBC has apologised unreservedly for the significant flaws in the government's pandemic preparations, which led to a higher number of deaths and economic damage during the COVID-19 pandemic. In James O'Brien's words, the preparations for the pandemic, the money set aside to prepare for possible pandemics, admittedly, the country was preparing for an influenza pandemic and not a COVID pandemic, was borrowed or purloined by those groups in government that were preparing for Brexit. And Jeremy Hunt acknowledged that being part of the groupthink that over-prepared for the flu pandemic while failing to consider other types of pandemics such as COVID-19 was a problem. Yes, it was a problem, but he shouldn't stop his apologies there. Hunt was often criticised for underfunding the NHS during the austerity drive and failing to address staffing shortages when he was Secretary of State for the Health Service, which led to increased strain on healthcare services. The British Medical Association, the BMA, repeatedly warned about the understaffed and under-resourced NHS, which exacerbated the problems during Hunt's tenure. Hunt's handling of the doctors' contract dispute in 2015 to 2016 led to strikes and widespread dissatisfaction among medical professionals, which hasn't improved until the present day. The dispute centred around changes to contracts that junior doctors argued would result in unfair working conditions and pay, and junior doctors receive so little. The people who clean the streets get paid more than junior doctors, and we are putting our lives in their hands. And despite promises, now this isn't to undervalue people who are cleaning streets. This is to point out how undervalued are the people who actually deal with our health when we present at hospitals. They're overworked, they're underpaid in the most egregious fashion. Despite promises to improve mental health services, Jeremy Hunt faced criticism for the slow progress and lack of substantial funding to address the growing mental health crisis, and reports highlighted long waiting times and inadequate care for those in need of mental health support. Several patient safety scandals occurred under Hunt's tenure, including issues with maternity care and inadequate responses to serious patient safety incidents. The Care Quality Commission, the CQC, found significant failings in some hospitals, raising concerns about the overall quality of care during Hunt's time as Secretary of State for Health. As for when he became Chancellor, under Suella Braverman, as part of the government's leadership, he faced criticism for the initial slow and inadequate economic response to the COVID-19 pandemic. Yes, of course, he was a great improvement on Kwasi Kwarteng. Hunt had no prodigious package to offer. What he did offer was a record of failure, which he continued in a sort of dogged fashion as Chancellor of the Exchequer, first under Suella Braverman, then under Rishi Sunak. And his inability to deal with the demands of the day mirrors his inability to deal with the demands of the day when he was Secretary of State for Health. The inadequate economic response that the government had to the COVID-19 pandemic mirrors the inadequate response that the government had to everything subsequent to that, under Hunt's leadership in the Chancellery, in the Treasury, as Chancellor of the Exchequer. Hunt, affable but inadequate. He was associated with the continuation of public sector pay freezes, which drew criticism for not adequately supporting key workers during the pandemic, for not adequately supporting key workers after the pandemic. I apologise unreservedly to families. That was the most terrible tragedy, what happened to this country during COVID. We should have challenged that group think. He should have challenged himself. He should have gone that extra mile. Baroness Hallett said the government's sole pandemic strategy from 2011 was outdated and lacked adaptability. Groupthink led officials to plan for the wrong pandemic. and to siphon off money elsewhere. Starmer said the country was underprepared for COVID-19. It's not enough simply to wring your hands and say, oh, we were underprepared. You were underprepared because you used the money elsewhere, because you didn't focus, because you were too caught up in your own silly ideology. He said, we are committed to putting better measures in place to protect and prepare us from the impact of any future pandemic. Well, what about all the people who died? The COVID-19 Bereaved Families for Justice group welcomed the inquiry's findings, but emphasised the need to address underlying issues of inequality and public health service capacity. The recommendations from Baroness Hallett's report aim to simplify overall official structures, involve external experts at the heart of the system, and create an independent body for pandemic preparedness. But that's about the future. When we're looking at the past, all we see is a stream, a snail's trail of lethargy and tardiness. And Jeremy Hunt is leading that snail.